This afternoon, ABC 7 is taking a deeper dive into this question. We're bringing in our own expert to gain some insight on this topic. And joining us now is Meg Harrell, also known as Nurse Meg. Nurse Meg is a registered nurse and nurse educator, focusing her main passion of educating the next generation of nurses with the tools they need to survive in the real world of nursing. Nurse Meg, thank you for joining us. We want to start out by talking about why so many healthcare hopefuls are turning to get fake diplomas. Why are they doing this right now?
Yes, well, a nursing degree is about 2 to 4 years of classroom training and then hours and hours of clinical training on top of that. Now, after you do graduate, you have to take a national exam, and about 30% of people don't pass that national exam. So the allure of a shortcut is pretty enticing.
And how are these fake diplomas not caught by the employee? I imagine they're making them look just like the real one.
Absolutely. So employers did everything that they were supposed to. They checked the names, they checked the licenses, they checked the schools and the credits that came from these schools. The problem was these schools were accredited. The fraud came with the actual classroom hours and the clinical training. It just wasn't there.
And what process do you think could be used in the future to make sure something like this doesn't happen? Because some of these businesses probably think, like you said, we did everything correct.
Exactly. It's a really hard question, and maybe there needs to be breakdown in the training and hiring processes. Maybe there's something that they can implement in the hospitals to assess their knowledge and skills to the person that they are hiring.
And I imagine this came at such a time. We're in such demand for nurses right now in the industry, especially with COVID. How did this impact the trust with patients, and did anyone, to your knowledge, get injured as a result of these not properly licensed nurses?
So the investigation is ongoing. So far that they say they haven't found any patient harm so far, but like I said, they're still investigating. It's kind of a big deal. Morale and trust is so important in our field because of our training.
Yeah, and the morale, from what I understand, has been intense anyway because of all the hours nurses are working right now, being short-staffed like a lot of fields, but especially in the health industry. A lot of you do this because you care about your patients. I imagine this is not good news for nurses who are doing the right thing and went through the proper steps to get their education.
Exactly. There's so much that goes into our training and specialization. I've worked in nearly every department in the hospital, and when things go wrong, your heart stops, you stop breathing. It's always a nurse there at your bedside first to initiate CPR, giving you that life-saving medication. We're the ones coordinating and saving your life, so the patients are putting their lives into our hands. We should be educated, well-skilled, and trustworthy.
Okay, and in today's world, just about everything, as we know, can be found on social media. We know you post your journey, your history in the field on social media. Why is this such an important tool for nurses?
Well, on Facebook, Instagram, and TikTok, where I post all of my helpful resources, it's like our virtual break room. And this is where we can get together and connect and support each other. You shouldn't have to go through the nursing journey alone. So reach out. There's a whole community of experienced nurses like me who want to share their knowledge with the next generation.
That was so wonderful of you to do. I know any nurse I've ever encountered, I just feel like is such an amazing individual. You work so hard and you're also knowledgeable. So thank you, Nurse Meg, and thank you to all the nurses out there for keeping us healthy.